I'm Ken Olson. I work for OHSU's telemedicine program. We're providing specialty services to a broad geographic region. Telemedicine lets us put our eyes on the patients instead of trying to guess what's going on by way of telephone.
My name is Dr. Miles Ellenby. I'm a pediatric ICU doctor and the medical director for the telemedicine program here at Oregon Health and Science University. As a pediatric ICU doctor, one of my jobs when I'm on call is to routinely field calls from around the state from different providers who have a sick child that shows up in their emergency department. The first case that comes to mind was a little baby who presented with a severe case of what's called meningococcemia.
That morning, Malia woke up and she wasn't her normal self, kind of fussy, not happy. Called her doctor, she didn't answer, took her into the hospital for a fever of 102.4. They did blood work, ultrasound, x-rays, urine, and sent us home with diagnosis of a virus. And I gave her a nap, and 4 hours later went to wake her up, and she wouldn't wake up.
It's that aggressive. This child presented at a small hospital on the Oregon coast. We were able to provide additional input to the physicians there on site, and in fact made a recommendation that they decide to put a breathing tube in this child. As it turned out, what would normally be about an hour-and-a-half transport turned into a 6-hour transport based on the weather. Had that decision not been made to put the breathing tube in, I don't think that child would have survived that transport. Telemedicine is saving lives day in, day out throughout the country, and organizations like CTeL are making it easier for physicians to provide care in this way.
So organizations like CTeL help streamline the regulatory and legal hoops that we have to jump through in order to do patient consults. We're basically treating patients via video conferencing. That's a new concept to insurance companies. It's a new concept to licensing boards. It's a new concept to everybody who regulates the medical industry.
I consider Malia my little hero because she's gone through so much and never give up, because had I not, she wouldn't be here today.
This is a dramatic example where telemedicine, allowing us to be present in the room, can make a dramatic effect and really save this youngster's life. We wouldn't be in this room talking about the ability of telemedicine to save lives if it weren't for organizations like CTeL creating new models for care delivery.